I'm Dr. Regina Will, consultant gastroenterologist and clinical lead gastroenterology at King's College Hospital, London, Dubai. A colonoscopy is an endoscopic procedure which requires the patient or the person undergoing the screening to clean the colon the day before. So the patient has to flush the colon by taking a liquid which will clean the colon. The following day, the patient will come to the endoscopy unit, meet an anesthetist who will explain about the sedation we give. We do the procedure mainly under sedation with an anesthetist administering a sedation which is not general anesthesia. It is a sedation which will make you sleep and not notice anything at all, but you will be breathing for yourself, which means it is a low-risk sedation. In principle, it can be done with just a little bit sedation or even without any sedation, but in general here in the UAE we do it with some sedation, which is a very low risk. We then transfer the patient to the endoscopy unit, and the endoscopist, myself, will insert a tube through the large intestine until the very end of the large intestine. And when we have reached the very end, we will slowly pull back, insufflate some air to expand the colon so that we can see every fold, and we'll look for these precursor lesions called polyps. And we will take a long time looking through every fold, every nook and cranny of the colon, withdraw the scope, and we'll be finished with the whole procedure in about 20 minutes. The patient will then wake up and feel well. Maximum a little bit gassy, but overall no pain at all, and they will be able to go home. Because of the sedation they cannot drive, but they can go home and go about their normal life. If we find an abnormality, then we will be able to remove it at the same time. We do find these precursor lesions, polyps in the colon, in more or less 6% of people who undergo a normal screening colonoscopy. These polyps can be very tiny or they can be large. If we have found a polyp, we have different options of removing it using a forceps and taking it away, or we can use a knife and take it away, or we can use a leash which we can put around the polyp and then conduct electric energy over that and cut it away. Overall, these are very low risk procedures which can be done within the initial colonoscopy. The colonoscopy is the gold standard for colon cancer screening, but of course it is an invasive procedure and it is not available for everybody for different reasons. The most simple way of screening for colonic cancer is doing a stool test for occult blood. There are many different stool tests, but the stool test for occult blood we use nowadays is called FIT test, which is a test where we detect blood in stool immunologically. Practically, it works that we give the patient a test sample to take home. The patient collects a very small amount of their stool, and then we deliver this sample to the lab and it is checked for blood. This is a very sensitive test which we recommend to do every year starting at an age of 45. If the FIT test is abnormal, that means we have detected blood, and that means the patient needs a colonoscopy. This FIT test is a screening test, means we can use it on a large amount of population to find out the small amount of people, about 5%, who will have an abnormal finding.